we're building a foundation model that records brain activity with the goal of diagnosing for brain disorder. Is AI better than humans at doing this? For sure. But the thought process is that humans still make better decisions. Top of the pyramid is human-computer symbiosis.
So, Kris, we met a while ago now, and we, I guess, got along because we're doing kind of similar things where we're both working in AI, and you're doing a really cool startup, Pyramidal. Is that how you say it actually?
Pyramidal.
Pyramidal. Sorry. Do you wanna tell us more about how you got there, like what you guys are doing?
Sure. Yeah. So I'll start with what we're doing on a high level. So we're building a foundation model that records brain activity with the goal of diagnosing for brain disorders. So you can think of it in the hospital, there's a lot of patients being recorded for their brain activity, but they don't have any AI that can rate their brain waves to tell you what's happening with them. So our software does the diagnosis on the brain activity and lets the doctor know what's happening with them. So that's kind of the gist of it, of where we stand. How we got there, it's a slightly longer story. I did not start in AI. I did not start in tech.
Yeah.
And I started working in finance. That was my first gig. And then
Where were you?
Thomson Reuters.
Oh, yeah.
Yeah, so that was way back when. And then in the Thomson Reuters acquisition by Blackstone, I was in portfolio ops. So kind of got into this operational strategy role by default. And then from there was able to pivot to tech, doing that at Spotify, pivoted to product at Spotify, but then started working a lot with audio waves and detecting things in audio waves, which turns out is a very similar principle as brain waves and detecting things on the brain waves. Got into product for that, moved over to Google, but then was working at Google in Chrome OS, specifically for healthcare.
Okay.
So that allowed me to get a little bit more healthcare business
So
experience.
then you had the waves and the healthcare kind of connection there. Okay,
Exactly.
cool,
And when
cool.
that came together, is how I kind of got involved with Pyramidal.
Okay. So you were at that point, so you went pretty quickly. You were at Google still. Your product manager was it product manager you were?
Yeah.
Yeah. So how'd you meet your co-founder? Because you did Y Combinator also, then you got a bunch of funding. You got funding from including someone from OpenAI, I think. That's pretty cool.
Yeah.
So how'd you get there?
Yeah, for sure. So so when I was at Google, I through friends, I got introduced to Dimitri. And Dimitri was doing at the time his PhD, had a postdoc, and had submitted, a bunch of proposals here and there to build a foundation model on the brain with brainwaves. He did it in 2018, 2019. So this is before, a lot of this stuff was even popular. So when we met, he's like, I have this idea, but I want to bring it to market. But I can build tech that can read brainwaves. And detect what's happening in people's brains. And I
was he already thinking about epilepsy? Because I guess that's what we're going to get to later. Or was he thinking about just, I want to do a foundation model of the brain? Was he thinking, so a bit of a tangent, I don't want to get too deep into it, but
sure.
we're looking at world models internally, and it's a big thing going on right now. So is that what he was thinking also? Was he really thinking just for the medical space, for, I think you're ICU mostly now, ICU epilepsy. Is that what he was thinking about at the time?
Yeah, it's a good question. So, he did his PhD in the hospitals with epileptologists. So that's where he got the idea that how people are detecting things on people's brain waves, and epilepsy being one of the main things that you detect on the brain waves today. But the idea of the model was, well, we can do epilepsy, but brain waves are underutilized because we don't know how to read them. So we can do a lot more with it. But let's start with epilepsy. But that's something we came up also together on. Well, what else can we use it in? And then ICU came about. But when we met, it was like, oh, look, AI has advanced to a point where we can build models to read brain waves, and let's see what we can apply that towards in healthcare. And then we brought that together. So he was been doing this for 10, 15 years prior to that. And then we made it into a business about 2 years ago. And then the next obvious step was, well, what is the fastest way to do it? Let's apply to Y Combinator. So we applied to Y Combinator.
Did you have, because I guess he had a thesis before, but you didn't have any product when you joined Y Combinator?
Not quite. We had a product. I mean, Dimitri, I wouldn't say it was a Pyramidal product, but Dimitri had built a product for a paper to
Okay.
show the efficacy of reading brainwaves using like machine learning.
Yeah, it was his thesis, I guess, kind of.
Yeah,
Part of, or one of the papers he wrote during his postdoc, presumably.
exactly,
Okay.
exactly. And then everything was built up on top from there.
Mm.
So when we got together, we're like, well, let's see how they're used today, who uses them, how is it outsourced, etc. Build a little business model, applied to Y
Okay.
Combinator in 2023, December
Mm.
or October, got it in December.
Nice. Nice. And then off the back of that, you got a bunch of funding, I guess. Like a lot of people were interested. So you probably led that more than Dimitri. Or was it
No,
a bit?
we tag teamed it. We were both in most of the pitches.
Yeah.
Dimitri, as the CEO of the company, led the pitch itself.
Mm.
So he would, present, and then I would come in to talk about the business itself,
Mm.
and where we plan to take it and how we're gonna grow. Um, in the early, I would say, like, post Y Combinator, our funding was, or our fundraising strategy has been more so on what can we build off of this, right? So the most of the interest was, can you even build this thing? Is it possible? Because the foundation model hadn't been built on time series data prior to this. Like, there's video models, there's music models, there's, um, all sorts. And now there's foundational weather models too, but at that point in time,
Mm.
they didn't exist as much.
2 years ago. Okay. When you say time series, you mean just one point at a time? Because like, so it's an autoregressive model, I assume.
So the data we're ingesting is all time series. So you can think of it as, like, LLMs ingest text as their modality, and then they do unsupervised training on text. Or we ingest time series data as our modality, which is EEG, which is
But
millions and millions of hours.
but every point in the time series
Is uh like half of a second or less.
right.
Like,
And how much data is it in there? But what kind of data is every
so we have a total of 9 million hours of data.
point?
I don't know, you mean like
As in, like, because a time series typically, like, for instance, in finance and trading, you have a time series which is going to be the price of a stock, say,
got it.
at a certain point in time, and that's a time series. And so you say, well, you have a series of multiple data point, and they just so happen to be distributed in time, and so you can say, well, every
Got it.
half
It.
second, I have this.
I
This
see.
was a price.
I see. So think of it as not having any label. So a price is a label on the data,
Yeah.
right? The unsupervised learning is, it doesn't matter. The labels would be the language of the brain, which is, this is an epilepsy, this is traumatic brain disorder, this is yada yada yada. That's
But you have like some intensities, I guess, right? Because you have different waves,
Yeah,
right? So you have alpha, beta. I don't really know how it works, but you have alpha, beta, gamma waves, so probably something like that.
exactly.
And at every point in time, you have an intensity,
Yeah,
a
different
frequency
frequency and yeah, time and frequency is
okay.
what you decompose it in,
Okay,
and
nice,
power.
nice. And then you probably have some labels. So there's some supervision at some point. You have some labels that come and say, well, this person was epileptic.
Eventually, what we do is the same way, like, you would use LLMs and you would be like, here's 10 bad movie reviews and here's
Yeah,
10 good movie reviews, and it becomes a movie review expert.
yeah.
We would eventually give it some like labels and be like, okay, go detect this particular thing.
Mm.
And it goes back into its memory and it's like, oh, I've seen this kind of a thing historically at some point. And then it fine tunes to that. But when we train it, it's unsupervised fully.
Yeah. Okay, yeah. That makes sense. So you essentially have just a bunch of data that you throw at it, and then so you have probably some reinforcement learning towards the end for the fine tuning bit,
Yeah.
where we're trying to say, okay, this is where someone had an epileptic incident.
Yeah, or like a seizure,
This is just a seizure,
or
yeah.
like, or there's like background declining below a certain point, which is
Yeah.
concerning, going towards brain death. There's a bunch of little things that you can see on an EEG in terms of bad outcomes, right? So seizure is a bad outcome. Brain death is a bad outcome. If your frequency gets very small, it's kind of like heart rate. You know how you see heart rate?
Mm.
Like in movies, you see they have a singular line, and
Yeah, yeah.
so that means it's no longer showing any frequency at all. So if it's trending towards that direction, you can kind of tell, well, patient's not improving, and things like that.
Okay. And so okay, so it's kind of obvious how you got, because of Dimitri, how you got to actually work on this, um, or how he got to work on this. But how has it been dealing in that sector overall? like in the US mostly. I think that's where you guys sell. So yeah, tell us a bit about how you operate, what you actually do. So
Yeah. So I would say my particular world sits in three spaces. One is obviously product. What product we're putting in front of customers? How does it work? What does it do? Two is regulatory, which is complete mess in the US, especially for AI. It's just not built for things like AI. And three is sales, which is takes up a good chunk of mine and Dimitri's time. And then the team is divided mostly into engineers and then a few non-tech people.
so around here, so you product, regulatory, and sales. When it comes to just you, where would you say how are you splitting your time across those three functions?
It depends on the time frame, right? If we close some deals and we stop focusing on sales,
Yeah.
and then regulatory is always going
It's a
on.
background thing.
Yeah.
Yeah.
And then product, like we would build something while it's being tested, we kind of ignore it for a few weeks,
Yeah.
and then we get feedback, and then we build it again. So, I mean, we're a small team, right? So, I think there's a deep tech, engineering, implementation, infrastructure, data. That's Dimitri and the machine learning guys, because that's very, very specialized. And then there's me, Cole, who you met,
Yeah.
and a few others that are focusing on this other side, which is how do we commercialize it? What do we commercialize it with? Like, what's the product? And as a part of commercialization, how do we stay compliant, which is regulatory?
Yeah. Which is probably your favorite part of the business.
Yeah, it's specifically tricky because, like, in the US, to be a medical device, they had medical devices historically as what FDA would clear.
Yeah.
And at some point, software started to function in hospitals. So they started calling them software as a medical device. So they didn't even change they didn't even have a new like way of approvals for software. They just slightly modified the medical device, and you just call yourself software as a medical device. So you have to do everything a medical device does plus some extra
Right.
things for software.
It's crazy.
Yeah, it's just not, there was no new thinking around it. And then you bring AI into the picture where the model constantly learns
Yeah.
and the model gets better. But the way it's built is your thing does not change. Like, you get approved once and that's your product. Like, it cannot get better, because if you get better, that's a new approval.
How do they even determine that? And there's so many nuances with AI, right? Like you might be changing the weights of the model, or you might be fine tuning, you might be doing some prompt engineering on top of a model. I don't know how you guys have prompt engineering per se. Probably not with your foundation model, but you probably have some sort of.
We could have, we just can't at the moment.
Right. So you just can't. So you just have new versions of it, which are iterations, I guess. And
Yeah.
then once they're out, you get approval, and that's it. That one's approved.
Yeah, and then you need to get the new approved. But you're exactly right.
That's
So
crazy.
some doctors want to see certain events more than other events, right?
Yeah.
Some doctors are like, I just want to see this type of seizure, not that type of seizure. That's almost like prompt engineering.
Yeah.
And but at the moment, we don't know how we're going to cross that hurdle when we do, just because of the way the regulatory structure works.
So would you say this is a big hindrance really for you guys? Because when you think about it, it's like, okay, you're sat there saying, well, we could save lives, but we're probably not going to save as many as we could just because there's all this regulatory pressure.
I would say, yeah. I mean, the problem is, like, because, I mean, is AI better than humans at doing this? For sure. But the thought process is that humans still make better decisions. And the idea is leave the burden of it on the humans. So give them a bunch of things and let humans parse through it.
Yeah.
Which takes more time, which could go down this rabbit hole of, well, are we maximizing the output that we can give? Hopefully over the years, lobby, build better use cases, have better conversations with the FDA and cross that hurdle. But at the moment, yeah, we got to work with the boundaries we have. But I always tell people, like, when you're building a healthcare business, it's, you can't look at a 2-year horizon. When we were in Y Combinator, everyone has like 2 million ARR and like 6 months of being a Y Combinator. And for healthcare, it's like we just have like more and more problems for the first 5 years, but all those problems build defensibility. You have multiple clearances with the FDA. You have, all these quality management system requirements you have to follow. But as you cross each of those barriers, someone or the other gives up on building a healthcare business. Then building reimbursement pathways, which takes 5 years. But by the time you get to that point now, and that's when the income floodgates truly open, where you get your reimbursement, you have your insurance partners, you have all the approvals that we need for the FDA, but it's not a field where quick money is so much possible as it would be in like
Yeah,
a SaaS
you're not
business.
building laughable.
Yeah,
Yeah,
exactly.
yeah.
Like,
No, I hear that, but it could at the same time it could be absolutely massive in terms of revenue eventually, right?
exactly. Eventually, you could hit the same numbers. I
Yeah.
mean, healthcare is such a big industry. Like everybody gets sick. We have such an aging population.
And if you sit in every hospital, every, I guess neurosurgeon,
Exactly.
neurologist, those are your
Neurosurgeon, neurologist, EEG technologist,
yeah.
and you could add modalities, add cardio to it, add MRIs to it. So there's, I mean, the tech, the most difficult part of the tech is EEG because
Right.
nothing for that exists. Image models exist, video model exists. You can kind of bring it all
Yeah.
together and give more holistic tools to doctors.
Yeah, that makes sense. And so you guys are building these, and then so what's your? Because you said 2 5 years, so you're predicting that. Well, I don't even know if you've broken even yet, how and when that's going to happen, but you're kind of on the path of growing revenue gently, I guess now because of all these things, and eventually you're going to have a point at which there's going to be this huge inflection, right?
Exactly.
Or a tipping point where all of a sudden you're just going to have a bunch of revenue.
Exactly. Exactly.
Well,
So,
that's a prediction, the hope, I guess, which makes sense. And so that means you don't really have. Would you say you don't really have real competition, or because like no one's coming after Google's probably not coming after you. Like there's no big players coming after you.
we don't know.
Okay.
We don't know. It's a tricky question because of what we know, no one's directly coming after us, but everybody is focused on neurotech. So Sam
Right.
Altman's starting a neurotech company. We don't know what he's trying to
Right.
do there, but he's doing something there. There's Neuralink, which is tackling an
Yeah.
adjacent problem. There's a bunch of implantable neurotech companies that are reading brainwaves from inside the brain. And then there's Jan LeCun just left Meta, went to Paris, raised a bunch of money, suing a healthcare company, but the word on the street is
Healthcare was a world models.
yeah, world model slash like a big focus on healthcare, and there is some rumors going around that there's a neurotech play there.
Yeah.
So
I guess if you can build world models, you can do anything, right? Which
yeah,
is probably And there is because Google has Genie, I think, and then there's Fei Fei Li also has world models, but it's mostly like for video games, I think, and
yeah.
data
I think
generation.
I think my understanding was his theory is multi-modal is the way to go, and
Yeah.
by world models like world models that can ingest all different modalities and kind of put them together in terms of producing an output.
Yeah.
Um, and time series, brain waves, and then he's been talking about healthcare and AI for a long time as being the place where we'll see the most improvement in terms of lifestyle, etc.
Yeah, I mean, that makes sense. That's definitely my thesis too. Like,
Yeah,
I strongly agree with healthcare being where things are going to head in the next few years. Uh, yeah, I think he's definitely thinking about multimodality, but also just how to represent the world in a what he calls what like a latent space that isn't directly mapping to say pixels for images or
yeah,
a data point for a time series, and having it in a way that we kind of comprehend. So, for instance, if you're building a self-driving system and a car is about to go behind a tree, you're not trying to represent every single pixel of that car, but
yeah,
you in your head understand that a car has gone behind a tree and what might happen there.
yeah,
So you just have it in a kind of like latent space. Um, then they're mostly using like self-supervised learning, I think, from what I've
yeah,
understood, which is all interesting. I don't know how it's gonna work, who's gonna compete. Like Nvidia has Cosmos also,
yeah,
so
yeah,
Nvidia's probably in there. They're definitely gonna
yeah,
have something to say about all that.
exactly.
So yeah, okay, so you have some big players, but you don't really know. But it's interesting because it might well be then like in a couple years, Nvidia says or whomever says, well, we want to really start looking at that, and you already have all the approvals.
That's the
And
problem.
at that point, you have options, I guess,
Yeah,
right?
that's the ideal move, right? Is what we want is, I mean, raise a bit, cross a few more barriers, raise more money. Cross a few more barriers, more money.
Yeah, yeah,
With more money, you build more defensibility,
yeah,
and then someone, we don't know what the exit strategy is going to be here, but there's options at
yeah.
that time. Like Nvidia is from what we understand, is looking into healthcare quite heavily. I mean, there's simple things like the Ray-Bans for Apple.
Yeah.
Sorry,
Meta.
Meta.
Yeah.
They have a patent to have EEG recorded through
Really?
them. We don't know if that's ever going to come out or not,
That's
but it's a
crazy.
thing.
I did not know that.
AirPods have a patent to record EEG. So they're already doing now heart rate, which is also time
Wait, sorry, do
series.
they have a patent? Does it even work, or is it just they did it just in case they wanted to add it to their product eventually?
Yeah, I mean, it has to be in a product roadmap at some point that, oh, we should record brainwave
Because right now,
activity.
actually, I saw the other day, like the AirPods that can record your heartbeat.
Exactly. So it's a very similar principle as brainwaves, right? So it's the first step of them adding more health metrics to the AirPods. And if it starts to record EEG, then that opens the floodgates of like it, neurotech truly going commercial.
Yeah. That makes a lot of sense. May you tell me more about how you guys operate as a team? Because I know you've been traveling around the world. So also you mentioned the three functions you hold mostly. So I think that one, the traveling is mostly a bit more for product because you go and you acquire data, I believe. And you do all sorts of other things. So you want to tell us more about that and how traveling has evolved and the other people in the team, where they sit, where you guys are now.
Yeah.
And yeah, maybe then we'll speak about more about some more predictions about where things are going into.
For sure. So I would say that so just team headquarters, New York, right? That's where everybody sits. We have a guy in London. We also have a guy in India. But for the most part, the team is concentrated in New York.
Okay.
Our main customer is in Cleveland, so we are in Cleveland almost all the time.
Right. So you're flying in. Does your co-founder also go there, or?
Yeah, so it's either him or me, or both of us. But then, or someone from the team is there almost all the time.
Wow.
So Cole, who you met, was there like through Christmas.
Fun Christmas.
Yeah, he I think he left the day of Christmas. But working with some techs, just labeling some data. So they want to move fast. They're doing some pretty cool stuff over there. And then we have our operations in Paris, some operations in London. We acquire data from everywhere, so we travel a lot for that. And we're trying to acquire potential customers everywhere, right? So there's these companies that provide EEG services, but it's humans looking at the data today.
Right.
So we can empower them to look at much more data or expand amount of customers they can look at with the same number.
So that'd be a sort of white label, because that's B2B2B, I guess.
Yeah. White label powered by Pyramidal AI, or just white label. Different people want to approach the market differently. Some people want to just sell their own products. Some people want to sell it like, oh, well, we are this particular AI that has some like weight. So then for that, we travel quite a bit. And I feel like the world is going back towards this world of doing in-person stuff. Like I feel like for the long time we would want to meet virtually only. And I truly felt like we had hit a little bit of a like roadblock in terms of speed because of that. Like you have one meeting and then there's no progress. Now you're with a customer for 3 days at a time, and every day you're covering a lot of ground. And by the last, you're like, okay, so what is the decision? Like, what do you want to do here? And you leave with a term sheet. Whereas if you try to do the same thing virtually, you're not having 3 meetings back to back on 3 days for 6 hours a day.
So you're saying you're seeing more of a people meeting more, well, probably because of COVID, right? That happened in the first place, and people are going back to that. Yeah. I was speaking to another friend who was telling me the exact same thing. Like, you need to meet, you need to take the flight, meet in person. It's super valuable. And then in your case, you get to then see them 3 days in a row, and then just agree on something.
Exactly. We meet their teams. We tell them what we're doing. We have dinner together. You get to know each other better.
So you trust. It's all about trust in the end of the day, right? And just getting them invested, also their time and their energy, and just seeing that, okay, this is something that's doable.
Exactly. Yeah, believe in it, that this is possible. How are we going to do it? Work through the process. And yeah, the in-person thing is, I truly think, I mean, in the US especially, right? Even most big companies, including Google and JP Morgan and whatever, back to 5 days a week in the office. Like I feel like we're going away from this world of being virtual.
Yeah, no, I hear that. Yeah, JP Morgan, yeah. Jamie Dimon had a whole thing about that. Absolutely not. Which is kind of fair. Obviously for some people it's hard. Like, we have someone in Hungary, for instance. You have someone in London, but you're based in New York. So, but he's on the data. Your guy's on the LM side of things. Well, on the modeling side of things, right? So he's he's probably just working on AI all the time.
Our guy in London.
Yeah.
Yeah, he's our founding engineer.
Yeah.
He's complete rock star. You know, one of the top top. Like super blessed to have him on the team. He does come to New York like every month.
Really?
Yeah, so we want we want to be all together
Right.
as much as we can. And while we have really talented people abroad, like we have talented people in India and elsewhere, but you know what we've noticed is when we're in person, we can bring things together a lot better. Even from a code perspective, like it's just much cleaner code written by the people that's in person because you're always constantly checking versus when someone's remote, if something slips through the crack, it slips through the cracks. You're not always looking at their work the same way you're doing it in person. So there is that. While it's way more expensive, there is a clear output and it helps us scale faster, right? Versus, yes, we can put a product together super fast, like an application internationally, but then if we can't build on top of it and we redo the code later, a lot of tech debt, it doesn't make sense.
Interesting. So you're saying, yeah, I didn't really thought that much about it. I haven't had much of that experience. I think it's harder to iterate on a product essentially at a distance. Yeah, and so your engineers will just sit down and say, "This is what we need to do. This doing this now."
Exactly. And every day, as a product person, like we come up with multiple changes, right? We're like, oh, actually, this button doesn't look good here. Let's move it here. Let's move that here. And in person, though, can you change it here to there? Let's test it. Okay, that's fine. Otherwise, it's like a list of requirements. We go through with them. It doesn't look the same as we want it to. Wait till the next day.
So how do you guys operate? So when you have how does a requirement flow down to the engineer in your case? Because you probably go to Cleveland or Dimitri goes to Cleveland. They complain about something. So are they using the product yet over there, or like how's it?
Yeah, some version of it. It's not super public, so
Okay. Yeah, you didn't.
yeah. But yeah, I mean the way the product requirements come our way is it's either them or one of the other customers.
Right.
It's we get a good sense of what they're doing every day. We build something, we test it with them. We release a feature. They're like, okay, we like it, we don't like it. We go change it. But then our tech guys kind of operate as PMs themselves. So we would just be like, this is where the problem is. We lay out a lot of the problems often, and then we collectively brainstorm. It's not like a Google-esque way where it's like, here's the product requirement document, here's the P0s. Because, it's still one product. It's like a small team focusing on that one product, so it's very collaborative.
Yeah. It's still a startup. Like you can move pretty fast if there's something changed.
Yeah.
Yeah.
And I guess the roles are more distinguished in terms of the machine learning does machine learning, back end does back end. Front end engineers are doing front end, product, but then we bring it all together as a team.
So surely you have part of your founding engineer. He's the one who just helps make it all fit together, right?
I would say that's Dimitri
That's
and
Dimitri.
him, them combined. But so the founding engineer, the one we were talking about, he's a machine learning engineer.
Right.
While he understands the whole spectrum, like he's on top of the back end code. He's on top of what's happening on the front end. His expertise lies on the machine learning, and that takes up a lot of time because that is the engine behind the whole operation.
Okay. So anyway, so hopefully this next thing is probably not going to be too much of a tangent, but because we spoke briefly, so you mentioned Neuralink, which I think is quite an interesting approach. And I'm wondering, do you guys see yourselves potentially getting into that space? What do you think of it? What do you think the future holds actually?
Like hardware, you mean?
Yeah, and more so than hardware, it's really human machine interface on a new kind of level. It's inside of you.
When we were fundraising, we had this conversation a lot, and this is Dimitri's favorite topic to talk about, right? So that's when we first talked. Like this is the stuff we talked about is like human computer symbiosis and things in that direction. So I think there's many ways of looking at this problem. Like one is implantables, which is the Neuralink way, right? There's some people building products that are not deeply implantable, but they're lightly implantable, which just goes slightly into your skin. And all they all do is two functions, right? They read the brain electrical activity and they give some signal in return, and it's this back and forth that
Yeah, well, that's the
you don't.
important bit because right now I assume you're just reading, whereas if you're actually trying to influence
Then we would want
how
to
the electric
stimulate.
circuits happens in the brain, you can do all sorts of things. I mean, I was reading some random articles where they make you smell things, right? I don't know
Yeah,
if it was Neuralink who was doing that, but they'll make you smell something by implanting something in your brain, which is crazy.
yeah,
Um,
yeah. I mean, it's a whole thing around neurostimulation, which is
yeah.
giving back. But I think where we're headed in a little bit is, well, we don't know what modality will take over, right?
Mm,
But at the end of the day, you need a model to read all that data, whether it's happening in the brain, whether it's happening like with earphones, or whether it's happening.
yeah.
You need a foundation model that can take large amounts of data and focus it on something. Kind of like basically what ChatGPT is doing with text, right? So that's where we think our niche in that world lies when we get there. Maybe it's further. Maybe maybe we go the hardware route. Maybe we don't know where it's gonna go. But
Because I guess because the important thing there is, I guess, because you said so the foundation model itself is not one necessarily that's just there to tell you whether there is a you don't destruct it, whether there's a seizure or not. It's really one that tells you how these waves are supposed to happen. So it's probably able to predict what the next signal is going to be like, right? That's part of it,
that's exactly the longer term plan, right?
right?
Is further training, further training. I mean, if you go back to GPT-1, GPT-2,
Yeah,
is more binary, like X or Y, seizure, not seizure kind of thing. As you train it further, you need more money, you need more GPUs, you and then you start to seeing more generative properties of the model. Um, and we're already starting to see it, so we know it exists. It's just a matter of doing that training, proving the first point, raising more money, doing more of that. And that's exactly the idea. Is down the line, let's say at the top of the pyramid is human computer symbiosis, right? There's one path, like build a model first. There's one path to build a implantable first. There's many different paths, but that's where it's all going eventually, is what we think as well. And so yeah, can you technically decode speech? Like if, like, for example, you're
from the
thinking
brain directly,
something
right?
and you can just
Mm,
write it. Yeah, it's possible. People have proved parts of it.
mm,
You need a big enough model to give it all the different variations. Though people have done it with very small.
mm.
Like if you think of X, it'll actually show that on
Yeah,
paper.
yeah. But
Um,
there's some paraplegic people or like heavily disabled people who are able to control their houses, I think, with
exactly,
just
by
implants
thinking of it.
or yeah,
So all
that's
that's possible with big foundation models.
yeah, and so you'll be able to, but and then that's probably where the Yann-LeCun worlds model, which are a bit one step maybe further than just autoregressive models, or will be able to perform potentially even more things, and that's probably where you guys will be looking at soon.
Exactly.
It's really cool. Um, and so yeah, so maybe tell us a bit more about so you were you always in New York with Spotify, with Reuters, Spotify,
Yeah, for the most
Google?
part. I did some time in Paris for both of
Yeah.
them,
Oh, really?
for projects, but
That's why you speak a bit of French now.
yeah,
Yeah. Very
that's
cool.
kind of where it came from. But yeah, otherwise mostly New York
Mm.
since university.
Since uni, right? And then you just left and did this. Yeah. So what's your next? Because you well, I guess it might not be something you want to say now, but because you mentioned a bit about the vision, but let's say this didn't really work out as planned, or it did kind of work out as planned. Yeah, you exited. What would you want to see happen? What would you want to do? Would you stay in health? Would you stay in AI?
Haven't thought about that, to be honest. If I really, like, I'm working 24/7, like there's no break. I feel like I have no time for family, for
So I'm gonna take
friends,
a
right?
break.
It's just like, yes, I would want to take a break if I'm out of this, whether it's
Yeah.
positive or negative. Once this is done, I'd want to take some time off. And ideally, I don't know, like the next thing, would I want to do tech or AI? Maybe, maybe not. Like, I mean, I also sometimes wonder, like, it'd be nice to run some legacy business where it's like a mom and pop shop, and
Mm.
there's like you kind of have full control. Like it's super fun doing a VC backed company, right? But it is a lot of pressure. It's a lot of expectations. You have other people's money. Like it would be cool to eventually maybe try to do something that's more like, mom and pop shop style, where you kind of run the whole thing and call all the shots.
What do you mean by mom and pop shop though?
Like legacy businesses, like manufacturing style businesses or whatever.
You want to do a roll up?
Yeah, and then you just buy a bunch of little companies.
Right. Okay. I hear you. Yeah, that's a big thing right now.
Yeah.
Because we spoke about regulation and how hard it is. You guys are pushing. But in terms of where you find that things are, when you tell us about things that you found to be easier than you expected, and things that you found to be harder than expected, like where's the hardest pushback that you?
So I think where they're easier is, I think we have good product market fit.
Mhm.
Where when we go to sell to customers, there's never a conversation of, oh, is this a need or not? It's like, obviously,
Mhm.
this is a problem. We kind of see it as a little bit of, when you solve deep tech problems, the problem is usually obvious. It's building it that's hard. Like, imagine like 100 years ago, someone was like, it would be cool if we could go from New York to London in 6 hours. Whereas I feel like, yeah, if someone could build something like that, that would be
Mhm.
quite cool. So in our case, it's like, well, it would be cool if neurologists don't need to do what they do every day. And like they can actually focus on seeing the patient than to be like looking at these things that are impossible for humans to read. But to actually do a great job of reading something that complex that a computer hasn't done before is the hard part. So now that we're getting good numbers, good evals on what we've built, we're realizing that it's a pretty easy, not easy per se, but like straightforward sell to the customer
Mhm.
of how we can help them. The hard part again just goes back to the government, right?
Mhm.
It's not just regulation, but reimbursement. Today,
Right.
humans are reimbursed for their time to look at patients, and that's how
Mhm.
doctors make money. And that reimbursement comes from government agencies.
Right.
When you make them more efficient, the AI needs to be reimbursed too, right?
But also, if you make them more efficient, they spend less time, so they can bill less.
So that's where the
That's a
problem
bit of an
comes, right? It's a weird place. So you can make one side, you can make a sell where well, you're going to look at more patients in the same amount of time, so
yeah.
it increases the reimbursement. But humans are inherently, well, I should get all that reimbursement. Like, how do I pay you? Or I want to pay you very little for making, So if you like, it's to be fairly compensated to use all the GPUs to make it happen is another tricky part. In the long term, I mean, there's a bunch of lobbying conversations about, well, AI should be compensated in
Yeah.
healthcare because otherwise we won't reach innovation, which is
Mm.
the way things are today. But at the moment, it is a huge hurdle.
Is one of the things maybe that if you use our model, say, you would have less people suing you for malpractice, right? And so your hospital, well, I guess you have to sell to both to the hospital and to the doctor themselves, right? But presumably the doctor and or the hospital will have less costs.
Yeah.
That's maybe is that part of your approach or not at all?
It is. The less costs come more from longer term things that are hard to see today, which
Mhm.
causes a little bit of a problem. Like if you diagnose a patient faster, the patient leaves the hospital faster. If a patient leaves the hospital faster, the bed frees up for the next patient. And for each day, for the first day, you get the highest reimbursement for a
Mm.
patient. And every subsequent day, it's just extreme diminishing returns. So if you have a new patient every day, then you make way more money than you would if the patient stays there for 4 days. So you want to diagnose them faster, technically. So the hospital does make money that way, but they kind of need to see it in practice, right? And there's this disconnect between what the doctors want and what the business people at the top of the hospital want,
Yeah.
who don't really quite follow what's happening EEG and like EEG tax. They're just like, am I going to save cost? How and or am I going to make more money? Are you going to increase my reimbursement? That's a difficult conversation to have. Like, yes, you could, but then you need to get rid of a bunch of people, which the neurologists don't want. Let's see.
Sorry.
Um,
um,
so it's a tricky world to navigate in, and not just for us, but most healthcare AI companies.
it's interesting. I think this tension there is between the incentives of various actors in the healthcare uh, system is an interesting one because at the same time, as a hospital, say at the extreme, you don't want everyone to just not be sick.
Yeah,
Like, it's kind of cynical,
yeah,
and there it's somewhat aligned because you say, well, probably there's too many patients anyways, so you can just see more people. But there's going to be a point if you guys make the efficiency increase by a certain point. There's going to be a point in which all of a sudden, well, there's diminishing returns literally to using you because you're too good. You make them too efficient,
Yeah.
and so you know they don't want to use you, and that's probably quite tricky. And then almost you would almost want to go at that point and say, well, we sell directly to the customer,
Yeah.
because then to the patient, yes, that's which is very far away, I guess.
Yeah.
But yeah,
Yeah. I mean, that is part of the plan as well, bring the neurologist to the hands of the customer for that
really,
reason.
yeah,
Where like, people should be monitoring their brain health the way we monitor the rest of our health.
yeah,
You should get a glimpse of early signs of like Parkinson's like 20 years before it happens so you can avoid it or slow it till you're like very old. And those things exist in the EEG. You know that they're there, but who's getting checked for their
yeah.
EEG on a weekly basis to know what those early signs are?
Yeah, that's probably what Apple is trying to do then with
Yeah,
those things.
exactly.
Yeah, that's interesting. And then obviously, I don't know how much. I don't really know the space very well, but I assume some of that information is gonna be also present if you do like a scan of some sorts. Like some of those indications of you might get Parkinson's later will be there. I think a lot of the time in the end it's gonna be, oh, you're gonna have to change a lot of your behaviors, which is gonna be tricky for people. But
Yeah.
or maybe there's gonna be new drugs. I don't know.
Yeah,
Yeah.
there are, yeah, like there's proven ways to slow down things like Alzheimer's and Parkinson's. I mean, there are drugs that can delay it.
Mm,
Um, but like it's about finding it early enough. It's like early interception and not waiting once you're
mm.
like deep in it because then you can't do much about it.
So we mentioned a bit what you would do later if this didn't work, or even if it did work, like you exited. But in the shorter term, you do have an idea of what you want to achieve, right? Like what is success in the next few months, the next year or so. And what is it? What is it like? Maybe your time scale is not like lovable, which is not, you're not looking at 6 months. You might be looking at
Yeah.
2 years. So let's say in 2 years, like what would you where would you want to be? What hurdles would you want
Yeah, I think 2 years, regulatory hurdles out of the way,
to have?
easy path to access a large number of hospitals. Right now, we're moving partnership to partnership, right? Where it's like, well, we want this, let's work on it together because it's not feasible to widely expand. In 2 years, where we want to be is, well, has everything it needs to be able to be sold. Let's just get into the sales cycle.
Mm,
And then on the tech side, we want to do a bunch of things, right? Scale the model, find some of the more generative properties of the model, add other modalities, look at EEG alongside, heart rate alongside,
right.
blood pressure alongside, MRIs, see what the holistic picture is telling you.
Makes a lot of sense.
Yeah, you kind of just, product strategy being improve on the product side to more and more adjacent markets within the hospital, but also being able to sell it without like headaches.
Yeah. No, that makes a lot of sense. And then yeah, if you get there basically in a couple years, your sales cycles would be much shorter, right? Because you go, everything's already approved, and you're just working on new stuff on the side with your engineering teams probably. Um,
Exactly.
so that means you probably have a couple fundraisers to go to
Yeah.
get there. Yeah. So it's a fun bit, isn't it?
Yeah, I mean it is it's a lot of work. It's fun at the same time, right? I mean
Yeah.
like being in a space that's unexplored,
Mm,
that's new to us, but it's kind of new to the world. Selling AI to hospitals, everyone's like, "Well, we don't know how to deal
yeah.
with it." So it's kind of a good position to be in, to be like an early mover in a space that doesn't exist.
So I don't know if you had to fundraise before this one, actually, but did you find that it was particularly easy, particularly hard to fundraise compared to what you have heard? Um, because you guys are probably going to do a next round soon, or you've already had an
Yeah, gearing up for it.
gearing up for it.
It's
Yeah.
coming up. It was first time around. I wouldn't say it was particularly hard. I think the reason just being we went through Y Combinator. Y Combinator put us in front of every investor in the world.
Mm.
So it was a matter of a few weeks fundraising.
So you definitely recommend Y Combinator, I guess.
For someone who's not in the industry, I would strongly recommend it. Like, unless you're a repeat founder, you have all the connections, it's a different story. First time founder, like, how do you even get in front of investors? How do you pitch to investors? Like, building a reputation in Silicon Valley is not easy unless you're a founder. So, well, that's the reason why I Combinator founder for a first time founder.
Yeah.
So I think I would strongly recommend it. I think it's the reason we were able to kick this thing off the way we
Yeah.
did.
Yeah. That's really awesome. So I think we're getting towards the end, but I want to Or maybe ask just from everything you've done, because you've gone from, I guess, finance to, I'm not sure how you would qualify what you did at Spotify. Was it?
I went into products, so
Yeah,
tech.
products of product tech.
Yeah.
What's if you were to think about the lessons you got from all this, from your journey really to where you are now? What are the main takeaways? Like some of the learnings you've got. Some things maybe you definitely think were terrible ideas, and stuff, and some things that you think were excellent. Like for instance, Y Combinator probably was a good idea.
Yeah, I think luckily, at least, I don't know, luck or how you want to put it, but everything led to the next thing. So I don't think there's any like bad, like anything that I'd be like, oh, why did I do this? Maybe if anything, I would be like, well, I should have gone into entrepreneurship sooner.
Right. Yeah.
Like I don't like, I would say like maybe 4 years ago, I would have been at a similar position of starting something than I
Mm,
was when I did it. Um,
mm,
like, I had this fear that I need to build more of a background, I need to get more things on my resume so that if all else fails, I can always go back to those companies. But once you started, you realize that like, like all these cursor or whatnot, they're like 22, 23-year-old kids who are doing it. So it's just about jumping into it sooner and taking the risk. I had a lower risk appetite,
mm,
and so it took me longer, but I could have done a lot of it sooner. But I think one thing that I learned that I do think that, you know, I may not have had before, or some people take some time to learn, is being able to execute. Um, like I think if I'm like, okay, this needs to get done for whatever thing we're working on, I'll make it happen no matter like what strings I need to pull or who I need to network or who I need to talk to. I feel like if I was much younger, maybe I wouldn't have had the confidence to go up
right.
to some C-level executive at a hospital and try to make something like that happen.
Right. So now you just find a way to make things happen, right? You find a route through to the right person. The first year, you're good at probably figuring out who the right person is, and then going to them and somehow getting in front of
Yeah,
them.
and getting what we want from them.
Yeah. And on top of that, getting what you
Yeah.
want. Yeah, yeah, yeah. That's quite good. That's
Yeah.
quite,
So it's been fruitful, but I think that was a process, right? Like a lot of stakeholder management at Google, where there's so many executives,
yeah.
so many people to convince.
Yeah, so you learn some things there, right? So it's not
Yeah.
like you probably wouldn't say, "Well, don't do Google at all,"
Yeah, no,
but just do 1 year maybe instead of like I don't know how long you were there for.
exactly. Like I was like 7 years between Google,
Right.
Spotify, all that. You could compress that for sure.
Right.
Because it's a lot of the times I feel like in those companies things move a lot slower. You have a lot more free time when you're in it. You think, oh, I'm working so much, but you really do have a lot of free time.
Yeah, yeah.
You could learn everything you need in a year and move on.
Like,
Yeah.
interesting, interesting. So yeah, no. So I think so yeah, thanks a lot for coming, and yeah, looking forward to seeing how you guys progress.
Oh,
Definitely.
thanks
And
for having me.
man, if things progress well, maybe we'll have you again on the podcast in a couple of years.
For sure. Thanks for having me. This
All
is
right.
great.